some uterine problems. Okay, so there could be a lot of causes of miscarriage.
How important is prenatal care in preventing miscarriage?
What is very important, firstly, we need to start the woman on folic acid supplement.
Miscarriage is a difficult and emotional experience that many women faces, yet it is rarely talked about. Joining us today, Dr. Manasi Naralkar, an obstetrician and gynecologist at Cloudnine Hospital, SB Road, Pune. She will share her expert insights on how to reduce the risk of miscarriages and support a healthy pregnancy. Welcome, Dr. Manasi, in today's episode.
Thank you for having me here. I am honored to be here to share insights on such an important topic.
Okay, let's get started. Okay, so doctor, what are some common causes of miscarriages?
Okay, so there could be a lot of causes of miscarriage. There could be some fetal factors, that is some problems with the baby, or there could be some maternal factors. Most common causes of miscarriages could be because of some genetic issues or chromosomal abnormalities in the baby. But sometimes there could also be some uterine problems, like there could be fibroids inside the uterus. Sometimes the cervix or the mouth of the uterus is inherently weak, because of which the mother might miscarry. In addition, certain medicines, some drugs, alcohol, smoking, and other such reasons could be the causes for miscarriages.
Okay. How important is prenatal care in preventing miscarriage?
What is very important, firstly, we need to start the woman on folic acid supplements, which is a vitamin that helps to prevent neural tube defects in the baby, because as we saw, any genetic issues or any chromosomal abnormalities in the baby could be a very common cause of miscarriage. Secondly, if there is any known risk factor, or for example, in conditions like hypothyroidism or hyperthyroidism, could also lead to miscarriages. So if there are any known issues, known medical problems in the mother, we could address them before she conceives. Also, during pregnancy, it is very important to continue her on follow-ups and give her medications, as well as undergo routine screenings, routine ultrasounds, in order to avoid miscarriages in cases where they could be avoidable.
So, doctor, is it safe to exercise during pregnancy to reduce the risk of miscarriage?
Yes, it is quite safe in normal, uncomplicated pregnancies to undergo or to continue with any form of exercise that your body is accustomed to before. Of course, you should always check with your doctor once before you can continue your exercise. There are very specific conditions, like, for example, a woman who has a history of previous miscarriages, who has bleeding during the first trimester, or somebody who has a history of short cervix or history of premature labor, in whom we ask them to avoid exercise. But otherwise, in healthy, uncomplicated pregnancies, you can continue exercise under the supervision of your doctor.
So, doctor, what dietary habit can help prevent miscarriage?
A diet which is rich in fresh fruits and vegetables, which contain antioxidants, drinking lots of fluids, staying well hydrated, eating good amount of protein in your diet is a good practice to follow in general. Plus, the two main causes which can cause miscarriages could be smoking and alcohol consumption. This is something that you must avoid ever since you start planning for a pregnancy.
Okay. So, are certain medications risky during pregnancy?
Yes. So not all medications are safe to be consumed in pregnancy. So please bear in mind that you should talk to your doctor before you take any medications over the counter. But in addition to that, please remember that it is not necessary that you need to suffer just because you have certain conditions or you have any issues in pregnancy. There are medications that are safe to take even during pregnancy, and you can take them under the guidance of your doctor.
So, doctor, how can one reduce the risk of miscarriage if they have a history of previous miscarriage?
So if you have a history of previous miscarriages, it is very important to get a checkup or a follow-up with your doctor before planning a pregnancy. There could be certain tests that we can run in order to find out what could be the reason why you have miscarried previously. If it is something that could be preventable, we can work on that. There are certain medications that we can give you, certain blood thinners, or any tests that can be done, like for example, any thyroid issues, thyroid abnormalities, which we can correct beforehand. Diabetes could be a cause of miscarriages, so a good sugar control is something that we can work on. And if at all there are any genetic screenings to be done, we could do that for you and your husband as well, and find out why the miscarriage happened. There are, even in IVF, there are certain preconceptional screening techniques that are available, in which we do an embryo biopsy. We send the cell for genetic testing, and we can choose the best possible embryos to implant inside your uterus.
Okay, so one last question. Can environmental factors contribute to miscarriage risk?
Okay, so more than environmental factors, I would say, because a lot of patients ask me this, that can activities that we perform, or if I go out, if I travel, if I climb upstairs, does that cause miscarriages? The answer is no.
Okay.
So if it is a healthy, uncomplicated pregnancy, no matter what you do, it is going to stay well, because I often give the example of construction site laborers, or women who do hard physical labor for 9 months throughout pregnancy. Even still, they go through pregnancy uncomplicated, they deliver healthy babies. So it is not necessary that it is determined by what you are doing. There are, as I said, there are very specific conditions in which we ask you to rest. I always say that, remember, pregnancy is not a disease, it is a physiological condition. We can carry your day-to-day activities even during pregnancy. So no, environmental factors like these do not directly contribute to miscarriages.
Okay, that's great. It was great having you here. Thank you so much for your time.
Thank you.
And to our listeners, if you found this episode helpful and informative, do share it ahead and subscribe to our channel for more such informative videos. Until then, take care and stay healthy.